A new book called The New Hormone Solution looks at the problem. Joining me now, Dr. Erika Schwartz, the author and the founder of Evolved Science. Thank you for being here.
Well, Alison, I'm thrilled to be here.
So let's ask the most obvious question. Most of us probably don't have any idea what a hormone imbalance is like. What do you look for? What are the signs?
Everything.
Okay.
Weight gain, insomnia, you said loss of sex drive, feeling horrible. You know, when your hormones are imbalanced, you're young, you're beautiful, you're fertile, you look sexy, you recover from being sick very quickly, you feel great. The problem is that when your hormones are out of balance, you start having problems. Whether you're a teenager who has PMS or acne, or you're a woman who's had a baby who has postpartum depression, or a man in his 40s and 50s who's starting to build a beer belly and becomes depressed, it's all hormonal. It's not just when you're in menopause that your hormones go out of balance.
So that can be, you know, two things. One, I think we tend to think of hormones, and we often think that this is a problem for women because we think of menopause and PMS and things like that.
Exactly.
But also, you mentioned the men in the beer gut. That can be hormonally related.
Oh, it is.
Wow.
It is. And their mood changes, and then they go and get, you know, a sports car when in fact they should be getting testosterone. So that's exactly what happens. Seriously.
So the Corvette doesn't fix the problem.
No, it doesn't. It doesn't. So this is the thing. Hormones, when in balance, when you're young and healthy, make you feel great. When they're out of balance, you have problems. And instead of having a million tests, think hormones first, then we treat with hormones.
So what do you do? If you do find out that your hormones are out of whack or you think that something's wrong, what do you do?
We put the hormones back in, estrogen, progesterone, testosterone, and you put them in ways that they are identical to what your body makes. They're called bioidentical hormones or human identical hormones. You put them back in, people don't get sick. Actually, women, as they get older, they increase the risk of heart disease and of breast cancer. If you put hormones in, that risk is kind of mitigated. It starts going down. So we have to understand that hormones define who we are, how we feel, how we think, how we act. They define us.
A lot of people think of hormones in relation to sexuality and fertility and not a lot of other areas.
Exactly.
But it sounds like they can really impact all aspects of your well-being.
They do.
And so if you have a problem...
We are our hormones.
If you have a problem that doesn't seem to be linked in any way to your fertility or sexuality, it could still be a hormonal problem.
It is. Whether you have PMS as a teenager, or you're menopausal, or you're a man who can't build muscles.
All of this can be hormonally related.
Always.
When trying to deal with it, talking to a doctor, what kinds of questions or things should you ask? What's the best way to approach it if maybe you're not hitting on that you have a hormonal problem?
Well, first of all, your doctors are not well trained. They don't know anything about hormones in wellness and disease prevention, which is what I do, is prevent disease by balancing hormones. So what you want to do is tell the doctor, listen, test my hormones. Maybe the problem I'm coming to you with, the headaches before my periods, or gaining weight, or not building muscle, or just being lethargic. Maybe not sleeping well at night. Maybe they're my hormones. So then test my hormones. The problem is that when you already have the problems, your hormones are not going to tell you where they were when you didn't have the problems. So you need a doctor who understands, who listens to you, who cares about you, who's actually going to want to keep you healthy rather than just doing tests. I'm doing tests.
Who knew hormones were responsible for that much? You did. You did. Thank you so much for coming in and talking to us about it, Dr. Schwartz. I appreciate it so much.
Thank you.
Thank you.